Hi, this is Dr. Sargent at Sargent Plastic Surgery, and today I want to show you a rhinoplasty case that I recently did. This was a closed rhinoplasty technique, meaning all the incisions were made inside the nose. There were no external incisions, which would be the open technique. This young gentleman was complaining of the contour of his nose, particularly on profile. He did not like the hook appearance to his nose. The tip dropped down, and he wanted a straighter dorsum, straighter profile. He wanted the tip a little smaller, and it elevated up. And so, through this technique of a closed rhinoplasty, I went in there and took part of the dorsum down here, but if you look at this part of his nose, it's very low up at the radix, which is right where the forehead and nose join. And so this part of the nose needs to be built up, this part taken down, the tip rotated up with more projection to the tip, and bring this part of the nose up. And so this is on the operating room table of exactly what was accomplished. You can see there's a cartilage graft up here to help bring up the dorsum. The tip has been rotated up. There's less of this columella, the nostril showing here, and the tip is smaller. Now, we took off his splint at 1 week out, and these are pictures that are actually taken right at the time of the removal of the splint. And you can see already he has a much narrower nose, even though there's still some swelling there. The nose is narrower, the tip is smaller, and the tip is rotated. The most noticeable change, of course, is always on the profile on this particular type of problem. And you can see the dramatic change that's been made in the contour of the dorsum. Here's his old nose, which he didn't like. The new nose has a much straighter contour. It's been built up at the radix, which is right here. The tip has been rotated. There's cartilage graft to give more projection, and the nostril has been elevated up. And so this is immediate post-op result, which is going to improve in the sense that as the swelling continues to go down, the tip will be smaller and it will look better and better. He was really excited with the result.